We are presenting here at ASH 2017 for the first time the results about next generation flow to monitor MRD in a large phase 3 randomized clinical trial. In this case, the Spanish 2012 study for transplant eligible myeloma patients. The study enrolled 458 patients, out of which 419 had an MRD assessment. MRD was in fact performed in over 1,100,000 samples. Therefore, this is the largest study about MRD in myeloma based on the number of samples. Our results, our results showed that NGF is therefore highly applicable in multi-center large phase 3 clinical trials. It is highly sensitive. The median limit of detection that was reached was of 3 per 10 to the minus 6. It was in the range of 10 to the minus 6 in approximately 90% of total patient samples. Most importantly, it was highly predictive of progression-free survival. Those patients with persistent MRD at the end of the study showed a median PFS of 40 months, whereas the median PFS was not reached for patients being classified as MRD negative, providing it was an MRD negative, again with a limited detection of 2 per 10 to the minus 6. Thus far, only 6 patients relapsed despite an MRD negative result. This is 3%. This is the first time we are seeing such a very low risk of relapse among MRD negative, and it illustrates the high sensitivity and specificity of the method. We try to look for specific features that could allow us to try to predict which patients could be a false MRD negative by a bone marrow MRD assessment. And apparently the only unifying event about these patients was the presence of bone-related plasmacytomas, both at diagnosis as well as at the time of relapse. So this is something to take into consideration, particularly on the need of combining an MRD assessment in the marrow, either flow or sequencing, plus an imaging technique such as PET-CT to capture this small number but yet a very important patient population. Last but not least, we showed that patients with high-risk cytogenetics achieving an MRD negativity have a PFS that is superimposable as compared to patients with standard risk myeloma, and again, a very, very low risk of relapse.